Nurses at the University of Chicago Medical Center plan to hit the picket line tomorrow to call attention to staffing issues. In just a year, more than 580 nurses have left the hospital. The union says there's been at least 100 vacancies there for more than a year, and they're just tired of being short-staffed and concerned about patient safety right now. From Illinois to Minnesota, nurses have been speaking out nationwide. They're demanding everything from more help to more pay.
And along with the protest scheduled in Chicago tomorrow, earlier this week, nurses with the Illinois Nurses Association voiced their concerns. They picketed outside the Illinois Veterans Home on the northwest side, calling attention to staffing issues. Well, joining us now live via Zoom, a registered nurse with the Illinois Department of Veterans Affairs, Fiba Varghese. Thanks for being with us today.
Yeah, and first we want to make it clear this is a protest, not a strike. But can you just tell us more about what you're protesting and whether or not it's impacting the patients at the hospitals that these nurses are serving?
Sure, of course. Good morning. My name is Fiba Varghese. I'm the lead INA steward at Illinois Veterans Home in Chicago. I'm also an RN1 working the night shift. So we currently have about 24 residents in our facility, but the facility is capacitated for about 200 residents in total. We only have 14 RNs working. We had way more than that. We have people starting and leaving within a week because of how either they're being mistreated by management, or they just don't like how the system is working. Staffing is very critical at our facility. Some of the days, one RN is expected to take care of all of these 24 residents. We have had multiple falls and hospitalizations between our residents. 3 of our residents actually, who were in our facility, actually left our facility because their family didn't think they were receiving the adequate health care that they needed. Most of our employees don't like coming into work because of how they're treated. We're not treated with dignity or respect from management or our administration. There's no appreciation for any of the work we do. There's no organization or communication between the management and staff. But we're hoping for a change for the staffing, because it is very critical for one RN to take care of these 24 residents. When we initially started, they said one RN would be taking care of 13 residents, but currently there are days where one nurse is taking care of 24 residents, and it is very critical, and there is a safety concern for these residents. As I said before, there have been multiple falls and multiple hospitalizations for these veterans in our home. So we're hoping for a change in staffing.
Fiba, obviously, you mentioned the need for more staffing, for more support from your employers. But what about burnout? How many nurses are just leaving the profession because they're burned out, certainly post-pandemic?
I want to say we have lost at least between 5 to 10 nurses already. We had a nurse start last week who just resigned within a week because of how things were going at our facility.
Wow, that is definitely a challenge, I'm sure, for everyone else who's carrying the load of the work that you mentioned. Fiba Varghese, thank you so much for being with us and sharing more about this as we just learn more from nurses about what you guys are experiencing. Thank you.
And thanks for all you do.
Of course, thank you.